Today I'm going to talk about abdominal pain. It's a chapter, I'm going chapter by chapter in the book that I wrote called No Medicine. So in terms of abdominal pain, it takes time to sort through the symptoms and what's going on with the abdominal pain. I think as physicians we try very hard to use the patient questionnaire to help us with our time constraints in the office, but it's going to fall short of taking a history. So the most important part in the history and physical exam is the history. So in terms of abdominal pain, trying to discern a number of things. How long does the pain last? How long has the patient had the pain? Does the pain come and go? Are there certain things that make the pain worse? Is it worse around the time of the patient's period if it's a woman? If the patient is a woman? Is it worse after eating? Is it worse related to bowel movements? So all those questions are important. Is it such that it will wake the patient up at night? Or cause the person to stop eating. All those are very important signs and symptoms. Location of the pain is important. Is it diffuse throughout the abdomen? We use the umbilicus or the belly button as a point of reference in terms of quadrants. So the abdomen is split up into 4 quadrants related to the umbilicus. Is it in the right upper quadrant, the left upper quadrant, the right lower quadrant, or the left lower quadrant? Is it around the umbilicus? That's known as periumbilical. Is it across the lower abdomen? Is it just above the middle of the lower abdomen? That would be suprapubic. Is there more than one abdominal pain? That can lead to confusion, so you want to separate those out if there's more than one abdominal pain. You want to reference it each time you talk about it. So the pain you're having in the lower abdomen, is that the one we're talking about? So you have to separate them out and consider them separately, because a lot of times people have more than one thing going on. And it may take several things to actually bring them in to see the doctor, because they don't really want to come in the first place, or maybe they've been putting up with something for a long time. People have a common condition, so they may have lactose intolerance, acid reflux, causing upper abdominal pain, lower abdominal cramps from lactose intolerance, but then something new comes along, perhaps a gallbladder problem. You got pain in the right upper quadrant. And then there's specific syndromes, such as gallbladder pain, usually right upper quadrant pain after you eat, radiating around to the back. Pancreatic pain is usually epigastrium. That means just below the center of the rib cage or xiphoid process. There's a little bone at the end of the sternum, at the end of the rib cage in this area. Pancreatic pain is usually epigastric, so the epigastric is that area, radiating straight through to the back. So appendix pain is more typically will start around the umbilicus, so periumbilical, that eventually becomes located in the right upper quadrant, with a sequence then of subsequent nausea, vomiting, and then fever. So there's a sequence, but these are the typical ways that patients present, but they can all be different, and particularly appendiceal problems in children are more difficult to diagnose. So you have to have a low threshold for doing a CT of the abdomen, or some special studies usually, to make sure that you're on the right track with your diagnosis. The quality of the pain is important. What does it feel like? Is it like a dull ache? It's like a toothache, or is it sharp like a knife? So quality is also included in the history. You should also keep in mind there can be radiation of the pain. As I mentioned before, with the gallbladder around to the right side, pancreas straight through, our typical history findings. You should keep in mind too that there can be foolers. Pneumonia that involves the diaphragm can present as abdominal pain. Same thing with myocardial infarction, inferior MI or inferior myocardial infarction that can affect the diaphragm, may present with epigastric pain. So there can be a number of issues going on, and it's important to be thorough and do testing such as chest x-ray, EKG, labs, along with your history and physical. The physical findings of abdominal pain, you look for point tenderness as opposed to diffuse tenderness. Abdominal rigidity indicates perforation and abdominal emergency. Rebound tenderness, where you push on the abdomen in one area, and when you let go, the pain is in another area. So typically like rebound tenderness from appendicitis late on, you might push on the abdomen and the upper abdomen, let go, and it hurts down in the right lower quadrant. That's going to be rebound tenderness in the right lower quadrant, and indicative of some peritoneal irritation and possibly appendicitis. So can be tricky, but that's the history and some physical finding issues having to do with abdominal pain. Now, the workup for abdominal pain is mentioned. If you're in the emergency room, then that's going to include an EKG, most likely a chest x-ray, may include abdominal CT or CAT scan, along with laboratory tests that may also include pancreatic enzyme testing, as well as comprehensive metabolic panel and CBC, and urinalysis. If you're a woman in childbearing age, you will most likely get a pregnancy test done. If you're in the clinic, you will likely just be examined, a history obtained, physical exam, and then a decision made about laboratory, which ones to run, and also decision made about imaging, such as CAT scanning or MRI of the abdomen and pelvis. Now, a funny thing has happened about CAT scanning and MRIs. When you order a CAT scan or an MRI of the abdomen, you have to order abdomen and pelvis, not just abdomen. If it's just abdomen, they will not look down in the pelvis. So generally speaking, you're getting an abdomen and pelvis. And most of the time, if you're not in the emergency room, you may get some contrast in your vein, or you may have contrast given by mouth or both to try to delineate the situation and diagnosis. And then once all that's done, a diagnosis hopefully can be reached, and then appropriate treatment. And we'll be talking some more about that in later sessions. That's all I'm going to say about abdominal pain. Thank you.